Most people have this question on their minds due to the present COVID-19 pandemic. Do antiviral face masks keep you healthy? During this article, we are getting to answer this question from different perspectives. According to the simplest evidence available, if you're sick, you will protect others from getting sick by wearing a mask. Similarly, if you're around sick people, you will protect yourself from the virus. However, keep in mind that these masks can't offer 100% protection against viral infections. By the top of 1800s, surgical masks, aka courtesy masks, became quite common for doctors to use within the operating rooms. Their popularity was sky high within the beginning of 1918 during the influenza pandemic that took the lifetime of over 50 million people over a course of 3 years. Around 100 years later, molecular techniques proved that the surgical type could offer strong protection against the flu. Apart from this, another study helped researchers counter the virus particles found floating around the patients infected with the flu virus. The researchers found that the surgical type reduced the emission of massive viral droplets by 25-fold. However, these products are less effective when it involves keeping away tiny viral droplets that stay within the air for hours. The surgical type offers strong protection, a bit like respirators. Unlike the regular masks, respirators are specially designed devices which will protect you from flu. However, you cannot use them as they're designed to be used in hospitals only. According to Australian investigators, if you set on a surgical mask, your likelihood of catching an epidemic infection goes down by a minimum of 60%. However, this statement is valid as long as you're during a home environment. Once you are outside, the protection level drops significantly. However, the matter is that the bulk of individuals doesn't wear a mask properly so as to guard themselves. Moreover, the Centers for Disease Control and Prevention is skeptical about wearing these products outside hospitals and other healthcare facilities. For now, there are not any recommendations for the utilization of those masks for asymptomatic people. And this includes even those that are more susceptible to complications. This statement is published on the agency website. So, what do you have to do? If you do not want to place on any sort of mask, experts suggest that you simply should stand a minimum of 6 feet far away from an individual who is already infected. This may increase your chances of keeping you safe against the infection. So, it's better to face or sit a minimum of 6 feet far away from the person you lecture. Apart from this, you'll want to scrub your hands more frequently. This is often important as your hands may transmit the virus to your body through your mouth, nose or eyes. Long story short, this is often the guide that you simply can follow so as to seek out if you ought to wear a mask for cover against a virus infection. Hope this helps.